Hi, everybody. Thanks so much for hanging out and listening to me, tuning in. Something I want to discuss today is part of our whole child approach to dental wellness and just kind of what that means. So when our patients come into our practice, we will ask a lot of questions that have some myofunctional undertones to them. And what does that really look like? So we ask about primarily feeding and sleep and speech. And we'll ask if our patients have any history with any difficulty there. And one thing that I'm really looking for is if my patients have a disordered swallow. And, what does that mean? So we'll ask if our patients have feeding concerns like picky eating, trouble with textures, slow or messy eating. And this can point to a disordered swallow pattern, which not only can make mealtimes more difficult, but it can increase the risk for cavities because if the food's not adequately cleared from the teeth, then that food residue stays on those teeth. And then if your natural swallow isn't clearing that food after every meal, then your risk of cavities goes up because that sugar substrate just stays right there on those teeth. And also, a disordered swallow can have some downstream effects. So especially if my patients have what's called a reverse swallow pattern or a tongue thrust, because what ends up happening, instead of that tongue going up and back and serving as a good way to clear food and also as a good lymph pump to move all this fluid along, just keep everything moving in the body. If we have that reverse swallow, one of the things that's going on is that muscle compensation, some downstream effects, that floor of the mouth trying to compensate and help swallow, those cheeks helping to swallow. And then we'll see the distalization of those condyles push down and back. So years of that, we can see some temporomandibular joint dysfunction as our patients mature and lose some vascularity and elasticity in that joint, which can be really painful and more difficult to rehab. And it's important to consider, like the ocean carves the shore. I say this if you're my patient, I always say that, like the ocean carves the shore, the swallow pattern will dictate the growth and of the jaws, those upper and lower jaws, and of those craniofacial structures. So if we can identify a disordered swallow, then we can help connect our patients to resources and to correct it, to get it back on track. And that's so much easier to do when our patients are little. It's a little trickier to do as we get older. So that's something that's really important that we look for here, that we try to identify, help with making sure our patients have just really good overall health and wellness, good growth, and good quality of life. So thanks for listening.